Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about self-care. In this video, we'll first look at what self-care is. We'll then look at some statistics, the aims of self-care, the benefits of self-care, and lastly, we'll look at some self-care practices. What is self-care? Self-care refers to activities and practices that can help to reduce stress, maintain or improve one's physical and mental health and well-being, and support the treatment and recovery of an illness. The World Health Organization has promoted self-care as an international priority to improve population health and support international healthcare systems. Statistics. In a 2015 Canadian survey, it was discovered that small shifts in the balance between self-care and seeking professional care would increase the capacity for the publicly funded healthcare system. In the United States, for every dollar spent on healthcare products, $6 to $7 are saved in other areas of the healthcare system through less doctor visits, costs of prescription drugs, and pharmacist dispensing fees. In Australia, reclassifying prescription medication to non-prescription can lead to more than $1 billion in savings. The aims of self-care are to manage psychological and physical health, identify and manage challenges, become aware of one's vulnerabilities, manage and reduce stress, nurture spiritual and emotional needs, foster relationships, balance one's personal, school, and/or work lives, improve one's self-awareness, and identify one's needs, strengths, and areas of improvement. Self-care practices require 4 elements: structure, intentionality, accountability, and adaptability. It is beneficial to incorporate these elements when creating a self-care plan to ensure flexibility and prioritization. Benefits. Practicing self-care has been clinically proven to reduce anxiety and depression, reduce stress, improve concentration, improve energy, minimize irritability and anger, increase happiness, reduce the risk of heart disease, reduce the risk of cancer, and reduce the risk of stroke. Evidence suggests that when healthcare professionals support, empower, and assist patients with self-care activities, this can lead to a decrease in morbidity, decreased mortality, and lower healthcare costs. Self-care practices. There are numerous self-care practices to help improve one's well-being. From an emotional perspective, these include talking to someone, reflecting daily, writing in a journal, reading a book, drawing or painting, listening to music, crying it out, hugging a family member or friend, laughing, practicing gratitude, and making an effort to be positive about your situations. From an environmental perspective, this can include cleaning your house, perhaps on a weekly basis, redesigning or reorganizing your room, enjoying the sun and fresh air. From a financial perspective, this can include creating a practical financial plan by yourself or with assistance, starting saving or saving more, investing wisely, and cutting back on unneeded purchases. From an intellectual perspective, this can include reading a book or articles, listening to audiobooks, watching a movie or documentary, working on a puzzle, trying something new, and taking a class. From an occupational perspective, this can include training for a promotion, editing your resume, applying for your dream job, doing a task that you enjoy, and setting goals and priorities. From a physical perspective, this can include taking daily walks. 30 minutes of daily walking can improve your mood and health. Eating healthy. A balanced diet with sufficient water can aid in one's focus and energy. Getting adequate sleep. Reducing the exposure to blue light from a screen before bedtime can help make it easier to fall asleep. And taking any prescribed medication. From a social perspective, this can include spending time with family and friends, maintaining contact with loved ones through text, call, or email, volunteering at an organization you are passionate about, using social media in a healthy manner, being kind to others, and limiting time with toxic people and spending more time with people who uplift you instead. From a spiritual perspective, this can include prayer, meditation, yoga, and finding your higher purpose. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.